everybody, and welcome to the second of our vlogcasts. The last conversation with Alice seems to be very popular, and I've had a request to talk to my co-chair, Jon Mathias, about advocacy. Advocacy is a very important part of the work that MPN Voice does. And so I'm delighted to welcome you, Jon, and to join in this conversation. And my first question to you is, what does advocacy actually mean for MPN Voice, and what sort of work is involved?
All right, very good question. And it's a good idea to start off with the kind of basics, as it were. So the word advocacy means speaking on the behalf of, and that is essentially what we do. So as advocates for the MPN community, what we aim to do is to represent that community in discussions with anybody who's interested. But there's a very specific sort of set of organizations that require the MPN community to be represented too. It's obviously not the only setting in which advocacy is important, but for us it is definitely where most of the work is. And that set of organizations are in England and Wales. It's NICE, so the National Institute for Clinical Excellence. In Scotland, it's the SMC, the Scottish Medicines Consortium, and in Ireland, it's called the NCPE. But they're all roughly equivalent in terms of what they do. And what they do is they make decisions about the value for money of new treatments that become available. So they're not making decisions about whether they're safe or effective, but they're making decisions about whether the NHS should pay for them. And so in that context, as advocates, what we're essentially doing is we're explaining to the decision makers what the impact of these illnesses is to people's lives and to the lives of the people around them, in the hope that by doing that we can explain, what we have to live with on a day-to-day basis, and therefore what the benefit of the new treatment will be. So we don't aim to be experts in the new drugs. We don't aim to be experts in the science of the illnesses. What we are, though, are experts in the illnesses themselves and the effects they have on our lives. And we draw very heavily in these representations, in these discussions, on the real life experience of actual patients. In many cases, patients who are using the new drug, either through a clinical trial or through some other method. And as advocates, what we do is we sit down with those patients and we discuss, their story, etc. And together we try to put together a picture of what it's like to live with those illnesses. And in some cases, the patients themselves can come to the NICE meetings and tell their own story. And in other cases, we do that on their behalf. And I would say that's probably 90% of the work that we do in advocacy in MPN Voice is we prepare written submissions, but also we attend the meetings themselves and try to speak on your behalf.
That sounds excellent, Jon. But are there any special skills and experience needed to do this sort of work? Is it something?
Yeah, another good question, and I've been asked that before. Well, one way of answering that would be to say, well, when I got involved in this, I had no experience whatsoever of this type of thing. I'm fairly used to kind of speaking in meetings and representing clients, etc., in the work that I used to do. I'm a school teacher now, so I'm obviously well used to the sound of my own voice. But in terms of special knowledge, not at all. Only the knowledge that I picked up in terms of working with MPN Voice, and listening to many presentations over the years from experts like Claire Harrison and other doctors. My guess is that if you're up to speed with your condition and you're comfortable in either writing about that or speaking about that, then you'd be ideally suited to working in this kind of field. And one thing I would say is that we're blessed in the sense that we have a lot of new therapies which are emerging on almost a monthly basis now. Every time I hear Claire talk about new therapies, there's a new funny sounding word that I have to try and remember, of a new drug which is either under development or being trialed or whatever. And that's great news for us, isn't it? Because it means that there's more effective treatments. There's the possibility one day of possibly even curing the disease. But what it does mean is that every single time one of those comes along, we need to make the case for the NHS paying for it. And one thing we know is that new drugs are always expensive. And so this is going to be a growing need, I think, for MPN Voice to be able to represent the community in the way I've described. So it's very important work, and there's going to be more and more of it as we go forward. But in terms of, if you want to get involved, bear in mind the things that I've said. I think the more the merrier, really.
That's great, John. So anybody who wants to get involved, how would they go about getting involved?
I think the first thing to do would be to contact Maz in the normal way through the info@MPN Voice email address. Maz tends to coordinate all the volunteers that come forward. And if you say that you're particularly interested in working in this field or contributing in some way, she'll put you in touch with myself or Caroline Thomas, who also helps run the advocacy effort. And also Andy Tattersall, who's been very, very active in the last couple of submissions that we've done. So there's a core of us at the moment, but we're always looking for more people to get involved. And Maz will put you in touch, as and when you think about getting involved.
That's great, and I hope that people will get in touch with Maz.
Yeah, me too.
It's always good to have a bank of volunteers who
absolutely, and I suppose that's worth pointing out as well. In the past, I think we've been a little bit guilty, if I'm honest, in MPN Voice, of people have come forward and offered their services, as it were, or their time, their effort. And I don't think in every case we've always managed to get back to them with something useful to do. And I think that is the nature of a relatively small volunteer-run organization. We won't always be able to match people up with a particular project at short notice. But you should always, bear in mind that we have you down on our list, and it may come around that it's time to for us to contact you and see if you're able to help in any particular respect. So don't despair if we don't immediately get back to you when you put your name forward.
That sounds great. How do you see patient advocacy developing over the coming years? I know one of the things that you and I have been involved in is it emerging that we're able to help the medical community in Ireland, Southern Ireland. And I wonder where we fit internationally. How do you see it developing?
That's another really good question. There's a couple of things I'd like to say on that. Firstly, I think I'm a great believer in international collaboration. I got involved in a group of other patient groups, just like MPN Voice, in other countries several years ago now. And I have learned a huge amount in my work with them. It's an organization called MPN Advocates Network. If you're interested in finding out more, we have our own website for that effort. And so in one respect, I think one of the futures of advocacy will be more and more international collaboration. I know that in the past, I've worked with colleagues from Germany, from Italy, from Israel on their own advocacy efforts, and shared some of the work that we've done with ours, and in a sort of reciprocal way, used a lot of the information and contacts that they've been able to provide. So I think that's one aspect of it. I think the other aspect is that going forward, I suspect that advocacy, patient advocacy specifically, will become more professionalized. And I hope that's the case. One thing I've noticed in the work that we've done with the drug approval submissions that I've mentioned is that sometimes the language used and the terminology and and some of the sort of the technical details of the appraisals goes way over my head, and I sometimes feel a little bit anxious that I'm not able to properly engage in those discussions. And I think what we will see over the coming years is that advocacy becomes a more recognized activity, and we might see some training emerging for people like myself and Caroline and Andy and anybody else who wants to get involved. Not so that we become experts in this. I mean, the field of health economics, as it's known, is a really massive field, and people spend their whole careers in that field. And I'm not aiming to be a health economist, but what I want is enough help to be able to engage in conversations with those people. And I think the growing professionalism of what we're doing will really help with that. And I'd like to get involved in that process, frankly. And there may come a time where it becomes something that you could study, that you could train for, and maybe there'll be a qualification for. We're not at that point yet, and definitely not in the UK. I have seen some efforts to do that in other parts of Europe, but we're not there yet. So, in a word, collaboration with other groups, not necessarily internationally, but collaborating with other groups like ourselves in the UK. Incidentally, we do work very closely on a regular basis with Leukemia Care. They're a much bigger and older organization than us with a lot more experience, and they've been hugely helpful. So collaboration, but also I think a growing professionalism and sort of crystallization of the skills required to do this job effectively. I think those are the two main factors I see happening, as well as just much more work, because as I've said, this sort of stuff is getting more and more important as more drugs become available.
Thank you, Jon. I think that's a really concise look at that one. Now,
I could talk about this stuff for hours and hours, and in the past I have. So
I know, and I think you'll agree with me. Since COVID came, as MPN Voice has really kind of upped the game in being communicating. Things like we're doing today, you know, and advocacy is another thing that's sort of growing and growing. And it's always difficult because we're a relatively small number of patients.
Yeah, that's true.
And it's not necessarily a go-to kind of neoplasm for research and everything. So we have to work that much harder.
That's true. And I think that's one of the reasons why collaboration for us is particularly important. You know, and nothing that I've said to you during this conversation is new. It's been going on in other organizations for many years. To a certain extent, we're learning our way as we go, but I think it's much wiser for us to try and use the experience of colleagues in other organizations that have been doing this for longer to help us be more effective and become more effective more quickly by doing so. We're not trying to reinvent anything here. We're only trying to do the best that we can for our patients in whatever way we can find. So I definitely a big fan of working with other groups.
I agree. I agree. Now, this is the next one. It's a little bit of a tricky question.
Okay.
And it's something that comes up, and I often get asked at forums and when we're sort of meeting people face to face.
Yeah.
And I've done the presentation of what MPN is and what we do.
Yeah.
Now, the question is about working directly with pharmaceutical companies and what sort of challenges that brings us at MPN Voice.
Right. Okay. You're right. It is a tricky question. On one side, we're not independent of pharma in any respect, because we rely on their products to treat our illnesses. And we rely on their research capabilities to develop new treatments for our illnesses. But of course, we have to remember that they're commercial organizations. They exist to satisfy the needs of their shareholders. And they need to make profits. They need to, that's what they're in existence for. They're not charities. They don't work for patients. They work for their shareholders. And that's why it's a tricky area, because the minute that anybody outside our community starts seeing advocates as essentially mouthpieces for the pharmaceutical industry, I mean, we do make the case for new therapy, and we explain the benefit of new therapy to our patients. But as soon as we're seen to be, in a sense, selling that therapy or promoting a particular company or something like that, our credibility disappears immediately, and we would never be able to make that argument again in any sensible or decision-making forum. And so it's extremely important that when we do represent the patient community, we make it extremely clear that we make our judgments and our recommendations and our representations completely independently of anything that pharma ever says to us. We like to understand what the drugs do, and we will explain the benefit of that to whoever needs to know. So that independence is extremely important, and whenever a pharmaceutical company comes to us and offers us support, for instance. So this is outside necessarily the field of advocacy, but in anything that we do in MPN Voice. And Nona, you know this from firsthand. We quite often get requests from pharmaceutical companies to display some of their material or put their logo on some of our materials. Or I can't remember what the last one we had was. They wanted to make a presentation of their own at one of our forums. That's a red line for us, because an external observer of that type of situation would immediately associate MPN Voice with a particular drug company, and that cannot happen, because I would never be able to do a credible job as an advocate for the community if other people thought all I was doing was representing a pharma company. And so that independence has to be absolute, not just internally in terms of the way we actually do our work, but also from the outside world. And we need to be very, very vigilant about maintaining that. And that has an impact in another way, which is there are companies which are quite sort of, in a sense, dominant in the field of MPNs. And we've received a lot of support for our activities, financial support for activities from some of those companies. But it's really important for us to spread the breadth of the support amongst a number of different companies, because again, that helps alleviate any suspicion that we might be kind of too close to one particular company or something like that. And I can't, hopefully you're getting the message that this is very, very important, because it could really it has the potential to really undermine the work that we do. And if there's any pharma company representatives listening, I hope you understand that needs to be our position going forward, because and I hope it's not disappointing sometimes that we're not able to do everything that you'd like us to do. But of course, we appreciate your support, and we always say that. But independence, I think, is an absolute requirement for us, for as long as we're doing the work that we do.
Jon, I totally agree with you. But I think what's evolving now, particularly with the forums we're doing joined up work with various different pharma companies.
And that's great.
So that it's not always going to be one specific. But I do want to actually also say that without the support of these pharma companies, we couldn't do the work that we're doing.
Excellent point. And especially in the context of the last couple of years.
Yeah.
So much of our fundraising historically has been based on what we call community fundraising. That's the community itself raising money. And, through no fault of their own, a lot of those activities we just couldn't do for the last 2 years. And our supporters, our sponsors in the industry have really stepped up during that time.
Yeah.
I would like to see our fundraising support get back to where we were previously, if we can. And I'm really hoping that all the fun things that our fundraisers have historically done will start happening again, and we'll have a broader base of financial support. But you're absolutely right. In the meantime, I think it's great that we're broadening our support, as it were.
And I think actually, genuinely, the challenges for us as a small charity, I know we're under the umbrella of Guy's and St. Thomas's Foundation, are that we are small, and we know the ghastly things that are going on in the world, first with COVID and now with the situation in the Ukraine, that people quite understandably will give to things that are right in the forefront of people's minds.
Right.
But what I always say, it doesn't matter if you can only give sort of a fiver, or every penny counts, because we don't have, apart from Maz's salary, any overheads.
Absolutely right. Absolutely everything else that we do is done by volunteers.
Yeah.
But some of the things we do cost quite a bit of money. So the events that we put on, etc., and the online forums, that they cost money as well. So we do have a cost base. We're not a huge organization, as you say, but we do have a cost base, and we need the fundraising activities that fortunately we've been extremely blessed with over the years.
Yeah. Thank you, Jon. I'm sure you will all agree. This has been a really useful time where we learn a bit more about the depth of the work that we're engaged in MPN Voice. And I think Jon and I, both as your co-chairman, do really thank the community for all the support we're getting, and please do, if anybody's got anybody they would like to be involved in one of these conversations that will be happening on a monthly basis, do please email Maz at info@mpnvoice.org.uk, because we're open to meeting the community's needs in any way that we possibly can. And so it leaves me to say thank you very much, Jon, and thank you all very much for watching this.
It's always nice to chat to you, Nona.
Look forward to seeing you all again next month.
Definitely.